Hi, guys. Welcome back to Those Millennial Pediatricians. I'm Dr. Aniksha,
And I'm Dr. Deshna.
and today we're going to talk about everyone's favorite topic, constipation.
Before we started recording this, I was like, can I look up some numbers for poop and
Sure.
constipation? And I was looking up just general data, and it sounds like I think 3 to 5% of pediatrician visits have to do with bowel movements or constipation. But then if you look at referrals to pediatric gastroenterologists, it's actually closer to like 25 to 30%. So for them,
Mm.
it's a bigger number, which makes sense. It's not an insignificant amount of
hmm
visits that we get to our clinics, which I'm sure you agree with. Okay, so let's get into our first segment, which is what is normal, what's normal pooping in kids. So typically it varies by age range, right? So when you're born, when you're an infant, when you're a baby, your frequency kind of varies. Some babies can go up to 7 days without passing a bowel movement. And I feel like I get a lot of surprise from parents when I talk to them about that. They'll be like, is it fine that he hasn't pooped in 2 days? And I'm like, actually, yeah, they can go up to 7 days without pooping. And it's always a look of shock. But yeah, it is true. And then just beyond that, it kind of varies on whether your baby's breastfed or formula fed. So breastfed babies tend to pass bowel movements a little bit more inherently because of breast milk being a little more prebiotic and digestible compared to formula. So that's kind of the pattern. And then age range when constipation tends to become a real problem is in the toddler age. And that's just because we're transitioning to solid foods and potty training. But also, I feel like it's also the most common range, like the 2 to 3 year range when picky eating, that sort of things start to crop up. So it's a common time for constipation.
Yeah, I feel like it's so funny because when we're in the nursery and we're like, baby should poop with every feed. And then they're like, we should see this many poops. And they turn like this. They're supposed to turn this color eventually. And then at some point they go home and they stop pooping. And it's like, well, they told me in the hospital they're supposed to poop this many times. And then they go to the pediatrician and we're like, now it's totally fine. And they're like, why didn't you tell me that? I feel like there's a lot of that of no one told me there was this transition period, which I think is really tough because all of a sudden it just changes over in that time that you're like home and not necessarily seeing the pediatrician. And then yeah, those like changeover and or transitions, especially I think also when they start when they start solids, I feel like around 6 months, that's like when I feel like we see a lot of the visits. And then yeah, when they're toddlers too, they get picky and they're only eating like French fries and chicken nuggets and mac and cheese. And you're like, you have no fiber to push anything along your system. And they're like, I don't want water. And you're like, okay, great. This is tough.
Yeah. And I do want to add there are certain red flags. I think we will talk about that a little more later on, but there are red flags. If your baby has definitely not passed a poop and our threshold is within the first 24 hours of life, we consider causes of not being able to pass stool through your colon and through your rectum, etc.
So I think that's a good segue into why kids get constipated. So typically it's a few different factors, not just like one thing that kind of really brings the hammer down. So one, kind of like Deshna mentioned, in the toddler age, there's that like withholding behavior. So sometimes they have like one painful poop. Maybe they're not drinking that much. One's a little bit harder. And then all of a sudden they're like, that stunk. That hurt a lot. I don't want to do that again. So I'm not going to poop again. And then all of a sudden you see your kid going like, no, when you're like, have you pooped? And or they're like kind of hiding in a corner and they're like trying to do it and you see their face get all red, but they just can't do it. That's one of the big cycles. The other thing that contributes to that painful poop in the first place, like I mentioned, is low fluids, low fiber. So picky eating, not drinking a lot of water. And so what that means is that when poop is going through your intestines, down to your rectum and through your rectum has to like kind of sense all that stuff coming. And part of that is that it has to be like bulky enough and it kind of has to be moving along. So if everything's just kind of stuck, not moving along, it's not really bulky, then your rectum's like, well, there's nothing here. And then finally, eventually, your colon's like, there is. You need to push it out. Everything can kind of hurt because it's like way too much for a very small hole to go through. And so there are things that we'll talk about that we do to treat constipation that help increase that bulk, help push things along, help that rectum be like, oh, yeah, time to come through. And so those are things that can kind of help with constipation. But we'll talk about that in like a second. And then the other one is just not enough toilet time or any distractions, or, if they're like going to school or they're distracted or they're just avoiding things, that then leads to more withholding. So it's really important to have regular potty time, regular toiling time, whether they do anything or not, it just gives them that sense of, okay, this is the time to be doing something. So that's super important. And then routine changes are something that can cause constipation. It's actually really funny. When a bunch of us took our intern trip to Cabo, I remember a lot of us bringing Miralax with us, because even as an adult with routine changes, you're not drinking as much water, especially if you're in Cabo. And then all of a sudden we're all backed up and we don't feel great either as adults. So that's definitely.
Yeah, I was gonna say a lot of it is also psychological. It takes just one or two really painful, really bad poops that you just kind of anchor onto, and then all of a sudden your child's like, nope, not gonna do it anymore. And then it's withholding. Your rectum somehow learns this, and then just you're unable to get anything out. So it's not a good time.
The other time that's not a good time is illnesses. So a lot of viral illnesses cause diarrhea, as we know, but then some of them cause constipation too, especially if they're not really eating solids, they're drinking pretty minimally, so then things aren't really moving along. And then you're like, okay, you're waiting for things to go back to normal, and then they don't really go back to normal. So that's one of them. And then stuff like medications, underlying medical causes like Daishna mentioned that we'll talk about again in a second. Those are a little bit rarer, but definitely can cause constipation. One of the common ones that we talk about a lot probably in our visits are kids who take iron supplements like iron tablets or iron liquid. That one can cause a lot of constipation. And so sometimes we get our kids who are coming back and they're like, I feel really bloaty and gross and I haven't pooped in a while. And so then we kind of have to rethink about, how much do we need that iron? Can we get that from food instead? Or do we need a little bit of that miracle stuff to kind of help us along?
So should we segue into red flag? Yeah, let's say you are bringing your child in, hasn't pooped. I feel like one specific instance that I recently saw, it was like 10 days, solid 10 days. And so of course that's definitely a very good reason to come in and see us. So what are the things I look at? If you're a baby, I kind of referred to it before, we call it delayed passage of meconium, or that first kind of black tarry stool that your baby will pass when they're first born. If it's been more than 48 hours and they still haven't had that bowel movement, we tend to look for more congenital causes of constipation. So that could include Hirschsprung disease. That's basically just when your colon doesn't have the nerves or muscles innervated to push stool out. Hypothyroidism, spinal issues, stuff like that. The other one is poor growth, or if your child is vomiting. The third one is blood in the stool. That is also a big indicator. Now, reasons when blood is actually expected is if you have something called an anal fissure, which is basically just a cut around the anus. And so when you're pushing really hard to get a poop out, you can cause that fissure, and that'll typically be, when you wipe, you see some blood on the toilet paper. Definitely still a reason to come in, but it can also be something as benign as that. And then any neurologic findings, numbness, tingling in your legs, your extremities, or an abnormal anal exam, that would refer to a lot of the spinal issues. Apart from all that, it's technically something that we can easily work through either with diet changes or medications that can help move your poop along.
Should we talk about what we actually do when you're constipated and how to make yourself unconstipated?
The magic powder, magic juice, magic pill.
Really, truly. I feel like the best way this is explained to us, I forget who explained it to me, but probably one of the GI folks over at UCLA. But basically, you want a mix of push and mush to get real graphic and TMI. Although if you're listening to this and you're relating to this, it's probably not even that TMI anyway, because you have a lot of questions anyway, and you see your kids' poops anyway.
Yeah.
But I guess if we start with the mushing part, basically part of it is, how do we make your stool softer or just a little bit easier to pass somehow, so that your colon, so that your intestines don't have to work so hard to do that. So the big one that we love talking about, the miracle juice, that is Miralax. And so Miralax, or polyethylene glycol 3500.
Sounds right.
Why do I not know which number it is?
3500. That sounds right.
We need to confirm.
Polyethylene glycol, and I'm like, order.
I think the 3350 is not the point, but it's still sad that I didn't know that. So basically, polyethylene glycol is an osmotic laxative. So if you remember back to whenever the last time you talked about osmosis was, whether it was last week or years ago, It is a solute. And so, what it does is the presence of it in your intestine makes all that water go from the cells of your intestine into your actual intestine. And that way, you're kind of increasing the amount of water that can help soften your stool and kind of mush everything up, bulk up your stool, and help kind of push things along. So, Miralax helps in that way. Another one we use very often is lactulose, which I've seen as well. Lactulose sometimes we use in like babies who can't take a lot of Miralax. So what you need to do with your Miralax is you need to take half a cap or a cap or how much ever you're taking. You need to put that in at least 8 ounces of water, and you need to chug all of that. If you're sipping on your Miralax throughout the day, you're just sipping some electrolyte juice and you're not really doing anything to really push everything along at once. So sometimes if it's really hard to do all of that, then you can take lactulose, which does the same thing. It's another osmotic laxative, so it works in the same way, but you take it in smaller amounts effectively. So that's part of your mush. Your other part of your mush is your docusate, which is kind of another stool softener. I feel like when we prescribe this stuff, it's just to kind of give it. I feel like every physician who's talked about docusate, like we do it to add it on to the regimen, but it is really not by itself going to really do that much for you. It's just so gentle.
Yeah, I don't think there's also a ton of great evidence on DocuSate.
Yeah, agreed.
Like even when they've done research on it, it sounds like DocuSate is almost like placebo or, I don't know, equivocal to not taking anything at all. So
yeah. So usually when we're giving DocuSate, it's like if we have a push agent and we need some sort of a mush agent, or if we're already doing like Miralax and Senna, which we'll talk about in a second, then we add on DocuSate to kind of help. But it's not really the first thing that we're reaching for. And so if that's something that you're going to the pediatrician to ask about, expect your pediatrician to be like, we can, but I don't know that that's going to be the most effective thing. And the thing with constipation is you don't want to be like slow about adding things, because then you're just really backing your child up. And then, we're having more painful poops, we're having more withholding due to fear. And so that's why we really want to be as effective as possible from the start. So that's kind of like your mushy stuff. And then there's more of your pushy stuff. The big one is Senna. So that's something that we give. It comes in like syrup form, it comes in chocolate form, it comes as a tablet. And so what that really does is just get your intestines to kind of really push everything along. And so that's why typically with Senna, we say to take it around bedtime, because it takes about 8 hours to kick in. And so by morning time, you're going to be pooping. If you take it in the morning or the middle of the day, sometimes you're up late at night pooping. And the other thing is, because it causes your intestines to kind of move along, it can be kind of crampy. So it's not the most fun to take, but also can be very, very effective. So usually we start with like your Miralax or lactulose. If that's not really cutting it, then we'll add your Senna to get kind of like a push agent along with that. And then the other one is bisacodyl or Dulcolax. I haven't really seen this given that much. Sometimes our GI folks will give it when they're managing constipation.
Yeah.
But I think usually we reach for Senna more likely.
Yeah. Okay, so we kind of talked about what the options are. So that's kind of like our quick intro to what medications we like to use. But then let's talk about phases. Typically, there are really 4 phases, starting from number 1, what we're going to kind of address over the next few days, and then what's the long-term change. So one is the clean out phase. So of course we prefer usually Miralax or the other regimens that we kind of talked about. That's kind of to just get things clear. Then is the maintenance phase. I think a lot of parents don't realize that this is not something that's going to be fixed over the next like 3 to 4 days or even a couple weeks. They'll probably need to be on a daily stool softener for months. And that's really to give the body and the colon a really nice reset. So that's the maintenance phase. The third phase is really behavior. So there is a biomechanic to pooping well. Number 1, regular toilet sitting. So we recommend immediately after eating, it'll typically be, go to the toilet 5 to 10 minutes, sit, learn how to relax. Your feet should be supported. So we love recommending this. It's the squatty potty. What it really does is relaxes your puborectalis muscle, and it kind of straightens the rectum out so you can get stuff out much easier than if your feet weren't supported. Also, positive reinforcement, right? So rewards and sticker charts for younger kids, that's actually worked really well. I had a patient, I think last week, that I was seeing follow up, and she had like a smiley face chart. So every time she pooped, she got to draw a smiley face and then decorate the face however she wanted. I don't know. I thought it was really like a smile. It was actually, I mean, she seemed really excited to show me. Also, these behaviors should never be punitive. So I think putting a negative context to these behaviors will just reinforce the cycle. So, kind of you're kind of trying to help them through it and try to keep your emotions in check as much as you can. And then fourth, I love talking about this. It's my favorite thing is diet and lifestyle. I think the reality is, so fiber almost acts as what Miralax is supposed to do. And so fiber is that bulk. It'll help bulking up the stool, and then it'll also help keep the stool nice and watery, like watery in the sense it'll help draw water into the colon and make sure those poops are easier to push out and not as hard. The reality is your child probably may not be getting enough fiber. So I would assume your kid gets very little fiber unless they're obviously ingesting large amounts of fiber and you're actually keeping a track of it. So some quick foods that I love to talk to parents about, all the pitted fruits, so all the ones with peas, so peaches, pears, prunes. I guess peas is technically not a fruit, but it is a food that has a good amount of fiber. Legumes, so lentils, beans, whole grains, and then lots of hydration. You can eat all the fiber in the world, but if you're not drinking enough water, there's no point. And then, of course, limiting all the constipating food. So eating lots of dairy is not good. Bananas, white breads can be really constipating. And then, of course, the reality is if you have a 3-year-old, good luck offering them maybe lentils. Sometimes, they're just not going to eat it. So talking to your child's doctor and saying, hey, would a fiber supplement be good for my kid? Because I think in reality, it probably would. Again, kids always need fiber and they're probably not getting enough. So I love talking about fiber at all of my well child visits because usually parents didn't know those foods had fiber or that my kid needed more fiber. Also, colon cancer, right? I mean, population we treat is often too young for colon cancer, but we're seeing it rise in younger and younger people. So getting that conversation started early. Hey, protein is good, but also eat your fiber because that's been shown to be correlated with rates of colon cancer.
Yeah, I feel like especially too, now that we're seeing a lot more carnivore diets pop up, there's so little fiber in those. And then those videos where it's like, if you don't poop, that's okay because you're not producing any waste. That's not true. You produce waste and it needs to go somewhere. You're probably not pooping because you're so constipated. And I feel like a lot of teens who are trying to put on muscle and things like that are looking at that. So I'd say in all those situations, whole grains and veggies and fruits are super important no matter what kind of diet you have, unless you need to be keto for some reason or things like that. But yeah. And if you have questions about nutrition, check out our nutrition episode that we just did before this. So that hopefully will answer a lot of your questions. So with that, let's move into myths and misconceptions. So the first one is they poop every few days. That's fine. So that's not always true, even though we just talked about that in the beginning, right? So sometimes babies will kind of slow down, infants may slow down, even toddlers too. Maybe they don't poop every day, but if they're pooping every few days, you still need to look at the overall pattern and other symptoms. So if they're eating a lot of varied foods, when they do poop, they poop pretty easily. It's soft. You're not noticing any hard pellets. There's no pain. There's no blood when they're wiping. That might be normal for them. But if you're noticing any of those symptoms, those are signs of constipation. So again, constipation isn't one definition of you have to pass this much in this many days. It's really individual for each patient. So that's why we ask all these kinds of questions. So it's really important to look out for all those different kinds of symptoms. And if you're noticing them, talk to your pediatrician and you can kind of decide together. The next one is, I don't want to use Miralax long term. I'm worried it's not safe. This is, I feel like, the biggest one because when you look at the Miralax bottle, it does say things like don't take for more than 7 days or don't take for more than this many days. And this is the maximum dose. And the reality is that that's really a guideline because it is a medication. Everything has benefits and risks, but Miralax in general for us is a very, very safe medication to use it within reason, right? If you're taking 4 caps a day and you're pooping essentially like water and you're dehydrating yourself and you're not drinking water and you don't actually have constipation or you have other medical conditions, for sure that's an issue. But for your typical healthy kid who does have constipation, it's very safe and very beneficial. And so the things to think about with Miralax is when you talk to your pediatrician, usually they'll be like, start at half a cap or start at 1 cap. But the reality is you can go up as high as you need to produce that daily soft stool. The way you know if you've done too much is if they're basically having diarrhea. And then you kind of know to pull back. I guess the other thing we didn't talk about is when your kid is having constipation, now that I think about it. And sometimes I'll get parents who come in who are like, they haven't pooped in like 4 days, but in between they're actually having diarrhea, but they're having a lot of pain and there's like blood when they're wiping. That's actually not diarrhea. Daisha's like shaking her head because she's like, oh my gosh, I know where this is going.
Yeah.
That is something called onchoparesis. So basically what happens is your rectum is full of this hard stool that just can't get past. So then this watery stool that's hanging out behind it just kind of goes around it and comes out instead. So that doesn't mean you have diarrhea. It means you still have constipation, but you've got watery stool around really hard stool. And so that's something to look for as well. So if you've got like a mix of like hard stools and a little bit of watery, then you know it's constipation. If every time your kid's pooping, it's just diarrhea, there's no blood when they're wiping, it's coming out pretty easily, then you know you've probably just gone a little too far with the Miralax, and all you have to do is just back off a little bit. There's nothing crazy behind that. So Miralax, otherwise, very safe. Things to worry about with Miralax that you can always ask your pediatrician about if you're worried about dehydration, if you're not replacing that with water, not replacing that with electrolytes. Those are all things you'd worry about with diarrhea as well. So very similar. The next one is they'll just outgrow it. So yes and no, right? So they can outgrow it when they kind of outgrow like their picky eating, or when they outgrow when they get over their illness, or they come back from travel and they kind of get back to their routine, or they're adjusting to something new and they fully adjusted. Those are things that can help you kind of get past the constipation phase. But when you're in the constipation phase, like Deshna mentioned, there's that fear cycle and you really need to break that fear cycle. And so as parents and pediatricians, it's really important for us to help them through that pain in all the different ways that Deshna mentioned, so that once they get past that, whatever that transition is that might be causing the constipation, we're not having that kind of come right back and rear its head again. And then the final one, which is like a favorite, fiber gummies will fix it. We get this one a lot too, I feel like, where it's like the fiber gummies. And again, right, the fiber gummies are supposed to kind of help with the bulking and the mushing, but like Deshna mentioned, they don't really do that, right? You need lots of fiber. And so taking a couple gummies here and there is really not going to be enough to help bulk up your stool. So they taste pretty good, and it's a nice like gimmick to try to get some fiber, but it's not going to do the same thing. The same goes for those like little fiber one brownies. Those taste so good, but they have like so little fiber, and you're like, there are so many other healthier foods I could be having.
I was like, it's also so processed. Also, like fiber gummies do not replace a good diet or natural foods. So it should never be a replacement. I wanted to go back. The Miralax, the other misconception, I've gotten a lot of comments. Oh, I'm afraid to use it because I've heard my kid's intestine can get used to it or used to the Miralax. And that's not true. So Miralax is a osmotic laxative. So it has nothing to do with like the stimulation of the stomach. That can sometimes be true of a lot of the stimulant laxatives, but the osmotic laxatives you cannot develop a dependence to, because all it does is help draw water out. It's not possible to get dependent on it.
Yeah, that's a really good one. I think the time it can feel like your body gets used to it is if you're not drinking enough water, then your body can't pull more water into your intestines. And so that's when you're like, I feel like it's not really doing what it's supposed to do. But you also need to kind of help it by staying well hydrated. That's a really good one.
All right. Should we wrap this up? All this poop talk. A favorite stool tip or a memorable constipation success story? My favorite stool tip to give is the squatty potty. It's like pretty cool when you think about the mechanics of it and like how much kids' lives improve when they're actually like learning how to position themselves, because they're too small. Your feet are dangling off the toilet. You have no reserve to position yourself that way. But that's my favorite. Everyone go buy it. Go buy the squatty potty. Maybe I wish we could get sponsored.
Yeah, that would be so nice.
We'll plug them.
That'd be so fun. Send me one. Give me one. Okay, let's see. Constipation success story. I feel like there were a few in residency. The one I've had now that we are out of residency is like this infant who like transitioned to solids and then all of a sudden was having like a ton of constipation. No like red flags or anything, but obviously like passing really hard small stools. And mom was already doing like prune juice, like she was on it because I guess she had a history of constipation too, which we see a lot kind of running in the family. She had
Mm-hmm.
done everything. So I was like, okay, well, you're not going to take Miralax. So here's where lactulose comes into play. We did lactulose, it didn't work. We kind of had to up the dose. That kind of worked for a little bit. And then we kind of like went backward a little. So we added Senna. And then that kind of combination of things really kind of helped everything out. And I think, she's still kind of on the lactulose to kind of get her moving a little bit. But I think it's just so satisfying when you're like, okay, we're going to go up a little bit and we're going to add this thing. And all of a sudden, the second thing is what gets parents like happy and like, they're not coming back over and over because their child's in so much pain and uncomfortable. So that's been
Yeah,
like a nice one since being out of residency and be like, I did that. I did that as
you
a
did
as
it.
a brand new attending. Oh, so my favorite stool tip, besides all the things that we talked about, is actually to just talk about poop at a young age, like all the time, like it's normal. So I think what was really funny is one day I was like at a coffee shop studying and I had Astro, our dog, and this kid came up to the dog and to my dog and was like pointing at him and was like, "Does this dog poop? Does this one poop?" And I was like, yeah, he poops. He poops every day. It's important to poop every day, like full pediatrician. And the mom was like, thank you. We're like starting to talk about that so that like, like everything and everybody poops. And she's like, this one? You sure? This one poops? I'm like, yeah, this one poops. They all. So I feel like
Just
just talking
normalizing it.
about it. Yeah, normalizing it that way when they're like talking about pain or things like that, it's not like this, oh, like we never talk about this. I don't want to talk about that part of me. And that can kind of be like a good first
I
step.
don't I don't know if you've heard of this video. It's called The Poo in You. Have you heard of
I
this?
have heard of it. Yay.
It's such a cute, it's like I had to look it up today again to like remember what it was, but it's an animated video that you can show to your kids and even parents can watch it, and it kind of explains like kids who are having soiling accidents, which is obviously so traumatic, but like it like normalizes it and explains why it happens and like how you can treat it. And it's a cute way to like introduce the concept to kids and like explain it in a way that's more understandable. You know what would also be cool? I'm going on very many tangents, but like
I love
the
it.
other day I helped a mom craft like a shopping list for like high fiber foods because they were going to go to Costco. What sorts of stuff should we buy? So we
Yeah.
looked up everything, and then magically, she was a teenager, but she was so much better in 2 weeks. I hope this was informational. This is just a really bird's eye view on how we frame and how we think about constipation and how we can treat it, and how it's also much more beyond just a powder or a pill we give to your child. And obviously, there are more conversations to be had, but this is kind of to introduce the topic and make you feel more comfortable with it and how you can tackle it at home. So, if you liked what we had to say in this episode, please subscribe. We are on Spotify and Apple Podcasts, and please follow us on Instagram. We're at Those Millennial Pediatricians.
And with that, thanks for watching and listening, and we'll see you at the next episode.
Bye.
Bye.